This is Mike Rosenblatt. I'm going to continue my video series on the False Claims Act. Last time I gave a presentation, it was probably about a year ago, 11 months ago. At that presentation, I discussed what a claim is, materiality, and knowledge. Today, I'm going to continue on with that and discuss the different types of false claims. There's a few of them which are the predominant false claims that you'll see out there. The first one is an overbilling case. An overbilling is usually when a physician, to give an example, a physician or a psychiatrist bills for services at a higher reimbursement rate. So sometimes a psychiatrist, for example, it's easier to use that as an example, will see a patient for 20 minutes, but bill for 40 minutes or an hour. That's an overbilling case. Another example of an overbilling case is years ago, certain pharmacies would short fill prescriptions. And what I mean by that is they would bill Medicare or Medicaid for 100 pills, but only give the patient 50 or 75. That's called another overbilling case, is known as a short fill prescription case. Another type of case is defective products. So defective products typically are related to like Department of Defense things, like an airplane has a defective radar or some other part of the airplane is defective, or a helicopter. It can also be things as simple as computers, light bulbs, radios. There's been a lot of defective product cases in the past where the government is paying for something, it's not up to specifications, it's not what they ordered and paid and thought they were paying for, they got something less than that. It'd be a defective products case. Another example is a false certification. So in many government contracts, a defendant, the contractor, has to certify they've done certain things, certify testing, certify maybe license requirements, things like that. So false certification cases are quite prevalent, and a case came out probably 2 years ago already, Universal Health Services versus Escobar, which I discussed in one of my earlier videos. In that case, a hospital, Universal Health Services runs a psychiatric hospital, and that they were certifying that certain healthcare providers met minimum requirements, and the allegation is they did not. So that's a false certification case. But in those certification cases, we have to make sure, if you're going to file one of those, that the certification is material, the misstatement is material to the government's decision to pay that claim. Another type of false claim, or typical type of claim, is a reverse false claim. So these became more prevalent recently because of a change to the False Claim Act, and because the Affordable Care Act basically says that if a defendant becomes aware that they owe the government money, they were overpaid, or they owe the government money for some overpayment, they have 60 days to return those funds, or it becomes what's known as a reverse false claim. I know I want to keep these videos short, just to kind of hit on some basic points, and that's all I'm going to address today. I'll have some information below if you want to click on my website. If you have any questions or comments, please contact me directly. I'll be happy to answer them. It's almost Christmas and the holidays, so have a happy holiday season, and I'll see you soon. Thanks. Bye.